Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. Question number 1 states, a 28-year-old female patient presents to the office with complaints of dysuria, urgency, and malodorous urine. Urinalysis results show positive nitrites and leukocytes. Based on these findings, how should the nurse practitioner treat? Is it A, doxycycline for 3 days, B, macrobid for 3 to 5 days, C, macrobid for 7 to 10 days, or D, Bactrim for 7 to 10 days? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, based on these findings, how should the nurse practitioner treat? And remember, if they're asking you for a treatment, you want to run it back and see if they have provided you with a diagnosis. If they have not provided you with the diagnosis, you need to take it back a step further and look at the assessment findings so that you can determine a diagnosis, so then we know how to treat. So the diagnosis has not been provided. So when we take a look at our assessment findings, we see we have a 28-year-old female. She comes into the office with complaints of dysuria, urgency, and malodorous urine. So, it's starting to put you in the mind frame of a UTI, right? Urinalysis shows positive nitrites and leukocytes, which confirms our differential diagnosis of a UTI. She is female. She is 28. Nothing else shows that that this is a complicated UTI. So the best diagnosis here is an uncomplicated UTI. So based off of these choices, the best answer is B, macrobid for 3 to 5 days. Remember, uncomplicated versus complicated UTIs does not determine the medication that we have to use. It more so determines the duration of time that we prescribe the medicine, right? So because this is an uncomplicated UTI, the guidelines state that we can treat for 3 to 5 days with it. Now, if it was complicated, then we would do 7 to 10. Okay, so the best answer is B, macrobid, 3 to 5 days. Question number 2. A 48-year-old male presents to the office with complaints of urgency and dysuria. Urinalysis result shows positive leukocytes and nitrites. Based on these findings, how should the nurse practitioner treat? Is it A, macrobid for 3 to 5 days, B, Cipro for 14 days, C, Doxy for 7 to 10 days, or D, nitrofurantoin for 7 to 10 days? Take a moment and tell me what you got in the comments, you guys. So, stem of the question here states, based on these findings, how should the nurse practitioner treat? So again, if it's asking for treatment, you want to look to see if they've given you the diagnosis. Here, they have not. So we want to look at our assessment findings. We have a 48-year-old male who comes in with urgency, dysuria, positive leukocytes and nitrites. So we're looking at a UTI. Being that he is male, this is considered complicated. Remember, the elderly, pregnant women, men, those are criteria that fall under complicated UTIs, right? So with this, there's nothing else that warrants that we should utilize any different medications. So the best answer is D, nitrofurantoin for 7 to 10 days. Remember, macrobid and nitrofurantoin are the same medication, generic and brand name. But we want to go with D because since it is considered a complicated UTI based off the anatomy of a male, we want to treat for 7 to 10 days. Okay, so D is your best answer. And then lastly, question number 3, a patient presents to the office today with complaints of dysuria and CVA tenderness. The urinalysis result shows positive nitrites, leukocytes, and proteinuria. Based on these findings, how should the nurse practitioner treat? Is it A, amoxicillin for 5 days, B, macrobid for 7 to 10 days, C, macrobid for 3 to 5 days, or D, Cipro for 14 days BID? Take a moment and tell me what you got in the comments. So here the STEM states, based on these findings, how should the nurse practitioner treat? So again, we're looking to see if they provided a diagnosis. There's not a diagnosis provided in this question. So we want to break down the assessment findings and see what's going on. This patient came in with complaints of dysuria and CVA tenderness. CVA tenderness is your key right here. When we see CVA tenderness, you want to start thinking of a differential of acute pyelonephritis. CVA tenderness, aka flank pain, right? They also have the dysuria. The urinalysis also shows not only nitrites and leukocytes, but the proteinuria. Proteinuria is another identifier that can put you in that differential of acute pyelonephritis. So based on these findings, that's what we're going with, acute pyelonephritis, and we would treat that with D, ciprofloxacin, for 14 days BID, okay? All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1, at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, I do have a self-paced review course for family and adult Gero. It's also linked in the bio of this channel. If you are looking for practice questions to review with, I have QBank options linked in the bio of this channel. And then lastly, if you're looking to book a one-on-one session, give us a call or shoot us an email. As you know, my one-on-one sessions are customized, so let's gauge. And I like to speak to you to gauge what you truly need, to tell you which option is best for your goals and your study style, okay? But as always, you guys, make sure y'all meet me back here. Happy studying. Bye, y'all.